So today we're with Linda Heiss, who is a dog breeder and also a pet therapist. And today we're talking about pet therapy. And we also have, who is this?
Sophie.
And what kind of dog is she?
She's a chocolate Labrador Retriever.
And is she a therapy dog?
She is a therapy dog.
Okay. So we just want to ask some questions to understand this thing called pet therapy. What exactly is it?
Pet therapy is where a dog goes into, or another animal, cat, rabbit, pony have been known to do pet therapy. They go into hospitals, visit with sick children or adults. They visit people that are in nursing homes or some sort of a rehabilitation medical center.
Okay. So just a dog or an animal visiting a sick person to bring comfort, relief. Okay.
Yes.
And what kind of dog can do this work?
Really, any kind of dog can do this as long as they have all the certification.
Okay.
And the certification consists of CGC, which is Canine Good Citizen, and Therapy Dog International. There are two separate tests, and they both do temperament testing. The second one is a test to see if the dog can be good around loud noises, not be startled, different things that you might see in hospital.
Okay. Okay. So what does the hospital require from you as a trainer or as a therapist and from the dog?
Well, you have to be good with kids, and you have to, the dog has to be certified, and you have to pass their test too. Okay. I had to do that with Mo, our black lab, who's now gone. They were testing him, but they were also testing me to see if I was going to be someone that they wanted in their hospital to visit with their kids, because they were saying, I trust you.
Yeah, so there's a very high level that the dog and the trainer have to reach to be able to do this work.
Exactly.
Okay.
Yes.
So what is your experience as a therapist?
I did therapy work with Mo for 3 years, and it was a wonderful experience, and it was very rewarding. You would go in and make some kids happy that were kind of bored and, getting shots and needles picked and, on them all the time. So it was nice to be able to give them a change of pace.
So you worked with children primarily?
Yes.
Okay. Okay. And what would like a typical hospital visit with Mo, what would that look like?
Well, he would get, we would knock on the door and see if, the child, actually we had to ask permission. We'd knock on the door and say, we have a dog visiting today, would you like a visit? And most of the kids said yes. Some of the kids said no, but most of them said yes. And then, if the child wanted Mo on the bed, he hopped up right on the bed, even though at home he wasn't allowed on the bed.
Right on the bed with
the
kid.
And we'd take over. Give the kid a little bit of room, and the dog would stretch out.
And they liked it?
They loved it. Yeah. They pet him and kissed him and hugged him and sang to him, and they really enjoyed it.
Was there ever a child who was afraid of him?
Yes, some of the children were afraid because in their neighborhood, the big dogs were mean, and they would see a big black dog coming down the hallway, and they would run in their room. And so I knew not to go in the room, but I would just knock on the door, and then I would ask if they would like to come out and visit Mo, and I would sit in the hallway. A lot of times they came out in the hallway and sat with Mo and petted him and figured out that he was not mean and he was nice, and they were able to enjoy him, and he was able to enjoy them.
Okay. So how do you think a therapy animal, a therapy dog, how does that help a sick person or child?
It changes up the day for them, and it's documented in many scientific journals that it does help a child to help recover. It gets their mind off of their daily routine, and it has been known to lower blood pressure, and just gives them comfort. And the dog is just very loving and sweet, and they just really enjoy being there.
Okay, great. Well, thanks so much.
You're welcome. Thank you.